Hey, hello. Good morning. So I'm here doing this live from bed because I had surgery on my foot Tuesday, 11 days ago, and I'm grounded for until Friday this week. So that will be almost 17, 18 days that I have to be, doing nothing, just staying in bed with my foot up. So today I'm going to tell you what happened and how am I feeling. So thank you so much for all of you who had been doing, sending me messages to get well, messages of, saying that you are praying for me. Thank you so much. And I'll tell you, you don't need to worry because before my surgery, I recorded a lot of videos and a lot of shorts. So I do have content to be posting on my channel even after my surgery. So what happened? Oh, first of all, let me see a lot of people who are here from Spain. Hi, Tina. Tina from Spain is here. If you can say where you are watching from, that would be great. I'd love to hear this. And at the end of this live, I'd like to send you with I'd like to pray for you because you all prayed for me. So this week and this past 11 days, it was hard because for me, not to be doing anything, for me, had to, stay. I cannot walk too much. I can walk a little bit if I stand up for maximum maybe 10, 15 minutes. I'm okay, but then I have to lie down. I'm now sitting here in the bed with my foot up, but most of the time I'm just horizontal, lying down with my foot up because when I do this, my foot doesn't hurt. What I had is, thank you so much. What I had is a surgery on my foot, and I found a picture on the internet that I'm going to share with you here. And it's not my foot, but it's a picture that explains the kind of surgery that I had. And I put here on my iPad. Let me see here if I can show you this picture. This is on the internet. The name of the surgery is called calectomy. And let me see here. It's too bright. Can you see? Maybe it's too bright, the light from my iPad. Let me just reduce a little bit the light. And the surgery is called calectomy. And I did this because I had this bone spur from France. Oh, wow, from Spain, France. I'm doing okay. So let me just show you what kind of surgery I had. It's called calectomy. I hope you can see. So I had this piece of bone here sticking out from my foot. So what happens is this is the toe here. This is the toe, and this is the metatarsal bone. And so this, you see this osteophyte going up here. And so after the surgery, the surgeon basically removes this piece of bone. So that's where my surgery was. And why I decided to have the surgery was because every time that I moved my big toe up, that spur hit the tendon or the nerve on my foot and it hurt. So it was hard for me to any movement. And when we walk, we do need to do that kind of movement. We do need our toe moves up and down, up and down, up and down when you are walking. And so I had to modify all my shoes. I had to modify, even doing a plank. You see me on the videos doing a plank, and doing plank was hard because you have to be on your toes. So it was hard for me to do plank. But basically, if I was walking and wearing a shoe that do this movement that moves up and down, it was hurting. So I had to modify my shoes. At home, I was only wearing a Birkenstock because Birkenstocks, they are hard, and the toe doesn't move. But when I went out and I was working, I was not working on my Birkenstocks, but I had shoes and nice shoes, and you move this. So at the end of the day, it was hurting a lot. And also for driving. When I drive, the gas pedal, you had the gas and brake pedal, you have to use the toe. Amazing. So it's a little piece of bone in my foot that was causing a lot of limitations. So this has been going on for 3.5 years, almost 4 years. And I decided to have the surgery. So I booked the surgery. The surgery went well. And it was June 20th that had the surgery. So now today is July 1st, Canada Day. And it's, almost 11 days after my surgery. And I'm doing okay. I'm doing well. I was, oh my God, there are a lot of people from around the world. So Spain, France, Trinidad, Toronto, Turkey, Australia. Oh my God, people from all over the world. Thank you so much for watching. Yes, so I had to book this surgery and make sure that for 15 days or 3 weeks, I had no commitments. So I had to cancel my clinics. I have only to stay at home. So, and even working on, right now I am on my computer, my laptop. But it's hard for me to work here because most of the time I have to lie down and put my foot up so that it doesn't get swollen. And it's hard to work on my laptop. So I can't do much work. I can basically get my cell phone and be, working on my cell phone, but there's a number of things that you can do on your cell phone. And so I basically cannot do a lot of things. And that for me is a major problem because for me, not to do a lot of things, not to go places and not to be walking and moving, it's hard for me. For those of you who know me, you know that being still and doing nothing, it's really hard. And so thank you so much for your messages. I got a lot of messages on social media to get well. Thank you so much. I see people here, Margarita from Colombia, Cuomo from Italy, Mark from Belgium. Thank you so much. Is that issue similar to a bunion? No, it's not the same thing as a bunion because bunion is the toe is deformed and this part of the bone here gets stuck. So mine is not a bunion, but I would say the post-operative period is very similar to a bunion surgery because it is in that part. And I can tell you, it hurts a lot if I put my foot down. And the other thing is also the stitches are, the skin is very tight because of the stitches. So what happens is, I think it is compressing one of the nerves that goes to my big toe because the tip of my big toe, I cannot feel. It's numb. But it's okay because once they remove the stitches, the nerve will be able to breathe again. And hopefully the nerve will come back. But thank you so much. Oh my God, Scotland, Belgium, Antwerpia, Mika from Antwerpia. Oh my God, people from all over the world. But one thing that I would like to say is that if you heard about CRPS, complex regional pain syndrome, some people have this as a chronic pain after surgery. So CRPS, I have a video about CRPS, complex regional pain syndrome, and that is a type of chronic pain that may happen after a minor surgery. CRPS may affect the hinge or the foot. And that was one concern that I had because some of my patients who have CRPS, they develop CRPS after a minor surgery or after a fracture or an accident or a nerve injury. And I said, oh my God, what if I develop CRPS after this surgery? And I did not. So far, I did not see any signs of CRPS. But if you are concerned that if you have a planned surgery of your hands or your foot, one thing that we know from evidence is taking vitamin C before the surgery prevents CRPS. So a lot of orthopedic surgeons, when they know they're going to operate a patient, they recommend the person to take supplements of vitamin C. And this is just, 500 milligrams of vitamin C pre-operative. Now, if a person has a fracture, they can't expect when they're going to have a fracture, so they cannot take vitamin C before. But that's why it's important to eat fruits. I recommend a lot of fruits, citrus fruits, oranges, mandarins, clementines, grapefruits, lime, lemons, um, um, pineapples, and even some vegetables, tomatoes and peppers. They have a lot of vitamin C. So if you eat regularly those citrus fruits or vegetables, you don't need to worry about being deficient of vitamin C. You get a lot of supplements from there. But if you don't, then take supplements of vitamin C, especially if you're going to have surgery. I did not develop signs of CRPS. My foot is okay. And that's because the signs of CRPS are basically, it's a lot of pain, excruciating pain, disproportional pain in the area that is not proportional to the amount of damage. So the damage is I have a scar about this size, and so I do feel pain in that part, but it's not disproportional. So CRPS would be the whole foot is hurting, the foot and the ankle, down, up and down, all the sides. So that is the first sign of CRPS. The other signs of CRPS would be a lot of swelling, redness, changing temperature, and also sensitivity in the skin. So touching the skin would hurt. So if after a surgery of the hinge or the foot, a person has CRPS, that's an emergency. They need to see a pain doctor right away to start treating this. But I didn't have CRPS. How am I now? Yes, I'm doing well. So I do have pain in my local, the surgery pain, if I walk, if I put weight on that place, if I stand up too much, then it starts throbbing. So as soon as if I lie down and put my foot up, then the pain is zero. I don't have any pain. In the first, I'll talk to you a little bit about the pain medications. Because after surgery, especially because, when they have to remove a piece of bone, after any surgery that involves the bones hurt a lot. That's a kind of nociceptive pain. The bones hurt. And so what happens is you can take painkillers, you can take anti-inflammatories, you can take analgesics, but they would just mask the pain for a little while. So my orthopedic surgeon gave me tablets of oxycodone. I brought home those tablets. And in the first few days, the pain was, especially the first night, was really hard because every time I moved in bed, the pain woke me up. But I did not take the oxycodone because I said, if I can tolerate this pain a little while, I know it's going to get better. And because I didn't take it because of the constipation, nausea, and vomiting. I'm very sensitive to those side effects. And I hate the constipating effects of opioids. So I said, okay, I put a little bit of ice on the first day, but the ice didn't really help. And then I took acetaminophen. I took 1,000 milligrams of acetaminophen, so 2 tablets of extra strength acetaminophen. And I took ibuprofen, and that really helped my pain in the first few days. So I took those tablets for maybe 4 or 5 days after the surgery. And I didn't take all the time. I only took them when the pain was really intensive. But now, for the past, I would say for the past 6 days, I am not taking any. No, maybe. No, I think 3 days ago I took acetaminophen. But I take 2 tablets at once of the extra strength, so that means 1,000 milligrams of acetaminophen, and that helps a lot. But what really helps, is not doing anything. Just keep lying down, put my foot up. It's almost like the swelling shrinks and the pressure in the foot goes down, because as soon as I go down and my foot and it starts swelling again. Yes. So yeah, I showed you the picture of the surgery that I had. Let me see who is here. You're looking for a good surgeon to do osteotomy. Yeah, absolutely. A good surgeon is essential. I hope you can find one. You are from Buffalo, New York, very close to here. It's about 120 kilometers from here. Thank you so much. From Greece. Oh, wow. People from Greece. Thank you so much. Yeah, so I'd like to know from you if you want me to do more lives. I'm thinking about doing more lives. As I said, I have content for videos. I recorded a lot of videos and a lot of shorts before my surgery. So I do have content to post over the next, I think, 4 or 5 weeks. I'll be posting some videos, very interesting videos. I'll be posting videos about a randomized trial that I participated. I'm a co-investigator of a randomized trial in the United Kingdom. I'm also going to post a video about a resource for people with chronic pain. It's a website. It's not my website. It's another website done by people here in Canada. It's amazing. It has a lot of things in that website. I'll be explaining that. And the other one is a video that it's a group of people from British Columbia, Canada, that they did about self-management tools. So I'll be explaining that. Those will be my next videos. But I'd like to know from you if you want me to do more live sessions. I'm planning to do maybe more frequent lives like this, not to talk about my pain, but to talk about your pains. And I'd like to know if you want me to focus on a topic, to talk, or just to answer general questions. I cannot give you medical advice. I will not be here to give you individual medical advice, but I can be here to answer questions about my videos, to answer general questions that you may have about pain, pain treatments, pain prevention, pain management, to answer questions about my book, my website. For those of you who don't know, I have a website that all of the handouts that I mentioned in my videos are there for you to download. My website is www.doctor.andreafurlan.com. So when you go to that website, you can, maybe I'll put here on the chat, you can go to About Pain. And in that section, you have to become a member. It's free for you to become a member. Don't worry. You just leave your name and your email and you enter that section. And there you will have my all of my content is organized by themes, by body parts, by exercises. And then when you go to those sections, all of my handouts are there. You just click on the handout and you can download, and then you can print at home all of my handouts. Thank you so much. May God help you and strengthen you. Yes, I would say, Deus te abençoe. Thank you so much. I would say that's the main thing that has been great for me during this surgical period. I got a lot of messages from friends, and one of my friends from Brazil, she's a doctor in Brazil. We graduated in the same class, and her name is Adriana. And she sent me a message saying, Andrea, take it easy this time that you are, at home. You don't need to do work and you don't need to do a lot of things. Take time to spend more time with God and the Bible. And that's actually what I did. I've been memorizing Bible verses. I've been praying, and I've been receiving a lot of your prayers and your good wishes. So I've been spending more time with our Lord Jesus, and that has been great. Really, really, I've been memorizing a lot of Bible verses. So at the end of this live, if you don't mind, I'd like to pray for you because I received so many prayers. And at the end, I will pray for you who are in pain, all of you who are in pain. So let me put here drandreafurlan.com. So that's my website for those of you who never visited my website. So then you can go in the About Pain section and download all of my handouts. I also would like to talk about my book. If you got a copy of my book and what you're thinking about the book, because I'd like to hear from you who are using the book or using um, the videos that I publish here on this channel to conquer your chronic pain. And I'd like to know, is it working for you? What are the things that you are doing, practicing from the book? The book is called 8 Steps to Conquer Chronic Pain, has been released just 2 months ago. You can buy anywhere where books are sold. And I would like to know, what did you think about the book and if it's working? So I know you don't need to read the whole book to conquer your chronic pain. I would love you to read the whole book, but some people will find parts of the book is what they needed. Some people is more step one, which is retraining your pain system. Other people will be the emotions. Other people will be the nutrition. So I'd like to know what is that is working for you from the book, 8 Steps to Conquer Your Chronic Pain. And then send me messages. We can even do a live together. I'd love to interview you on this channel because I think other people need to hear from you if it's working for you, because they hear from me, but they may not believe, oh, she's a doctor, she doesn't have chronic pain. How can she know that this works to conquer chronic pain? I know because I've seen people over and over and over my 30 years of experience to conquer chronic pain with simple steps, with self-management, with the tools in the toolbox that I talk about in my channel. So I know it works because I've seen, but I think you need to hear from people who have conquered their chronic pain. So then you will know that this really works because you need to do the work. You need to, I can give you the tools, but you are the one who have to do the hard work. And I know it's not easy, but also it's not complicated. It's not rocket science. It is good sense. So the things that I put in my book are really lifestyle modifications, self-management. I have a lot of tips for you in the book. So please read the book. Denise is saying, wish we had physicians like you in upstate New York. You're so sweet. Wishing you a quick recovery. Thank you so much, Denise. I bet you have excellent doctors in upstate New York. I hope you can find them. And I know you're going to find them. And yes, so thank you so much for Norwalk, Connecticut. Wow, that's great. Thank you so much for watching here today. And yeah, so if you can send me comments, you can send me direct comments, or you can post comments on my website if you have applied the 8 steps, if you are using the book, or if you're using the videos, please write to me. And if you would like to be on a live with me, I would be happy to interview you here and we can go and talk about that. Yeah, so regarding my recovery, this Friday, July 7, I will see my surgeon and he will remove the stitches. And I hope, he told me I can walk normally after July 7. So I hope this will work well because it is hard just to do nothing, just to keep here doing absolutely nothing, just waiting for my foot to recover. Now it's not a lot of swollen. In the beginning, it was more swollen, but now it's the swelling is going down, especially if I don't walk, especially if I keep quiet with my foot up. It does help a lot. So if you don't mind, I'd like now to pray for you if you are in pain. I'm Christian, so I'm going to pray a Christian prayer. If you don't want to hear this, you can disconnect right now. But if you want to hear this, I'd like to pray for you who are in pain, because I know this is so hard. Pain is not just a biological thing, but it's a biological and emotional problem, and it hurts. Sometimes it hurts the soul. I know a lot of people who have chronic pain, they are hurt inside and out. And sometimes the emotional pain, the spiritual pain, the loneliness is worse than the pain itself. I know this because I talk to my patients and they feel abandoned, or they feel not understood. They feel that even the healthcare professionals sometimes don't understand them and don't believe in them and stigmatize them. Talking about stigma, the opioids is a big problem, because if people need opioids for the pain and they request that from their doctors, they may be stigmatized. Oh, you're a drug addict, you are looking for these opioids, all you want is these opioids. That is so, so sad. I feel so sad for those people who are suffering from pain. And they, on the top of the suffering from pain, they also have this suffering from a healthcare system that doesn't understand chronic pain, and a healthcare system that really makes it worse. I'd say some professionals make the pain suffering worse by not understanding what the person is having, by not providing a compassionate care, by not listening to the patient. Sometimes it's because of time. They don't have time to spend with a person. I know. It's hard, but I'm trying to educate the healthcare professionals. I have a lot of courses and programs that is to educate healthcare professionals about chronic pain. And this YouTube channel is to help you, the person who is suffering from chronic pain, even how you communicate with your doctor. I do have a video on my channel that is how you communicate with your doctor about your chronic pain. And another one is how do you communicate with your doctor about the opioids? If you want opioids, if you want to stop the opioids, how do you open up that communication? Because a lot of people are afraid even to open up that communication. I know the doctor prescribed me oxycodone for this surgery, for my foot surgery, and I did not take it because I was afraid of the constipation, nausea, and vomiting. But I was so grateful that I had the prescription because I did not know how bad this pain would be. And of course, if the pain is extremely high and intense and bad, I would need to do this, take this medication. But fortunately, my pain was controlled. I did not need oxycodone. As I said, I was only taking acetaminophen and ibuprofen, and that helped with my pain. And I also did a lot of the things that I teach in this channel to try to improve my tolerance to pain. I was trying not to panic. I was trying to decrease my stress levels around this surgery. Every time that I thought about CRPS, oh, is this going to develop into CRPS? I immediately stopped thinking about that and I distracted myself with other things. So I did some breathing exercise, I did some relaxation exercise, and I prayed a lot because prayer is my meditation method of meditation. So before I end this live, I'd like to pray for you. If you are in pain, this is my prayer for you. Dear God, I ask that you please bless the person who is listening to this live right now, that you touch their body, that you touch their soul, that they may feel relief, that they may feel your presence, that they may feel that you are with them. They are not alone, and you will help them to find good healthcare professionals. You will find them to find relief for their pain. Please, this is what I ask in the name of Jesus. God bless you all. Thank you so much for being a great supporter to my channel. Thank you so much for being here today and listening to my brief story about my pain, my surgery. And don't worry, as I said, I hope you get better, and I hope you are going to see more videos from me, videos that I recorded before my surgeries. Thank you so much for watching this today, and I will put this live stream on my channel for you to watch after. Thank you so much. Yes, you follow me on Facebook. Other people come out from India. Thank you so much, Daniela. Thank you, Nicole. Thank you, Karim, from your hearts. Thank you, Shikar. Mala, thank you so much. I had a tremendous pain in my left leg from hip to toes, visited 3 different doctors. They gave me the same muscle creams and same painkillers. None of them gave me opioids. Yeah, maybe because they didn't think opioid was good for you. They know you better. Thank you, Banier from Philippines, for being here today. I cannot read this name here. I'm sorry about that, but I wish you the best. You are so special to all of us. Greetings from Greece. Thank you so much. And thank you all for watching today. Goodbye.